Dümdüz.
Okay, now we are looking inside, and when we enter the bladder, quickly we see these abnormal leukoplakia tissues around the bladder neck. These are actually not extreme compared to many of the ladies, and this lady has a recent infection, not very old, a couple of years. And these are the patchy tissues. I can see the inflamed tissues here. And here, look at these tissues. These are the abnormal tissues. So, look at these tissues. There's a layer, abnormal layer is formed, and this causes chronic inflammation infection. When I scrape, look at these tissues. And yeah, inside, underneath, I can see the leukoplakia tissues. Yeah, all the bladder, trigone, mucosa is sick. And now, this is urethra. Urethra seems quite normal, but just in the entrance of the urethra, I see a carancule-like, this one. These are sometimes causing obstruction in the outflow of urine. So we will also resect this part externally. So here you see these abnormal mucosa. Okay, we can see these floating particles. Look at it. I scrape these mucosa. They just come to the ureteric orifice in the right side. That's the cause of the kidney pain also. And this part, they are all inflamed. Now we will fulgurate these parts. I am marking the borders. I can't come just close to orifice, but all the bladder mucosa is affected. So look, this is an abnormal mucosa. This is a normal mucosa. This is a normal mucosa. And additionally, this part, it comes into contact with the back wall of the bladder. I always look if there is any problem in this part. If the problem has jumped from this part to the back wall, we call it grade 2 disease. Here, I am suspicious there may be some increase in blood vasculature. So I will make a control. I will empty the bladder and we'll see if this part will come into contact with the trigone. Okay, when I empty the bladder, you see this trigone part, and this is the place I marked. And additionally, the upper wall of the bladder now seemed to me a little inflamed. This is also coming into contact. This part is coming into contact with this and trigone. So this part, you see, the mucosa is changed. You see the difference? This is not a normal mucosa. So the inflammation may pass to this part. We are making some point fulgurations here to stimulate new tissue formation. Yeah, this will help for new tissues to be formed. It's different than other bladder mucosa. This is a healthy part. This part is not healthy. Yeah, these will stimulate new tissue formation. And the rest of the bladders didn't bleed it. This is a good sign for me. And now I will continue fulgurating the base. Look at this. These are all inflamed tissues. When I scrape, they come out. This is not the normal bladder mucosa. Yeah, it comes close. Look, this is normal. So this is our border here. And this is ureteric orifice. I can come into that part. I will do that way. This is a normal bladder mucosa. This is an abnormal. Okay, now I marked and I will begin fulguration like this. Sometimes the deepness, look, there is a classification here. Deepness may be not enough, I can make it deeper. But first I am superficially fulgurating the marked places.
Başlat.
Yeah, this is the top, upper part of the urethra, bladder neck. These parts are always missed, and infection usually is forgotten here. So I see little tiny polyps here. They are not so big, but still they are here. Look at these polyps. These are all formed because of infection, and these must be cleaned. They are full of infection. When I fulgurate, you see some infected particles coming out. It's more abundant in the right side, which was expected actually. The patient has more symptom in her right side inguinal area, radiating to the kidney. See these little tiny polyps. Actually, they are not present in our literature. We don't know the effect of these polyps. But I see there is always, when there is inflammation, we see such things. So in normal people, we don't see them. I want to clean them all. Okay, now we are completed this fulguration, and yeah, it seems the rest of the bladder is quite healthy. It didn't bleed. This is a good sign for me. And we fulgurated some other parts in the back wall that are seen to be inflamed with the touch of this inflammation part. Look at this. I'm making some point fulgurations in such suspicious places. Other than that, it seems quite healthy, and we fulgurated the bladder neck too. It's nice, and now I will resect the condylomas in the outside of the urethra. There are some little tiny bleedings.
Out of